which is the workflow to perform a molecular diagnostic analysis in patients with suspected gene mutations. So again, for you, Adele.
Yes. So when we have a patient, for example, in our outpatient clinic, and then we look at the data and exams, and then we think, okay, let's take a look at the genomic background of this guy, or eventually we think, what if this guy has this kind of mutation? I give you an example. I saw a few months ago a male, about 45 years old. So he had sclerosis tuberosa, that is a genetic disease due to a mutation of TSC2 gene. And he had this kind of problem since when he was young. About when he was 30, he started to have chronic kidney disease, and just doing an ultrasound, he realized he had polycystic kidney disease. This was the only man and the only person in all the family that had cyst into the kidneys. So for those that work often on genomics, remembering that there was a sclerosis tuberosa and also a DPKD, me and also my colleague that worked with me. So what about if the patient have a copy number variation of the area of the DNA where PKD1 and TSC2 are located? So actually, I draw the blood of this guy, and I'm waiting to see if there is a copy number variation, meaning a loss of a very, very large part of the DNA, including both genes. So this guy came to my clinic, outpatient clinic. He now has end-stage renal disease, and he drew. First of all, I explained to the guy what I was thinking, and the informed consent is the most important part of the story, remember, because there are very rigid rules behind an informed consent, and the possibility that we have to manage blood, urine, saliva, whatever we work on. Then I explained to the guy what I was suspected. Then once we have a signed informed consent and the blood, it's important on the tube to give a specific sample ID to each sample, because once we have taken the tube of the blood from the guy, we will go to keep this blood in a large biobank usually. So we need to have a spreadsheet. These are very basic concept, that this is the basic to let a genetic clinic to work properly, because the mistake is behind the corner. Trust me,